So let's imagine that we do something pleasurable, we eat chocolate, engage with social media, etc. That releases dopamine in the brain's reward pathway, and our pleasure-pain balance tilts to the side of pleasure. But no sooner has that happened than our brain will do the work to restore homeostasis by downregulating dopamine production and transmission, involuting postsynaptic dopaminergic receptors. That process is called neuroadaptation, sometimes referred to as allostasis as opposed to homeostasis. And I like to think about that as these little neuroadaptation gremlins hopping on the pain side of the balance to bring it level again. But the gremlins like it on the balance, so they don't get off as soon as we're level. They stay on until the balance is tilted an equal and opposite amount to the side of pain. And that is the hangover, the come down, the blue Monday, or simple craving, that moment of wanting to have one more piece of chocolate, one more glass of wine, to watch one more TikTok video. Now, if we wait long enough and let craving pass, the gremlins get the memo that their job is done. They hop off the pain side of the balance, and homeostasis is restored. But what if we don't wait? What if in this world of overwhelming overabundance, we continue to consume our drug of choice over days to weeks to months to years? Well, those gremlins will start to multiply. They will get bigger and stronger, and eventually we will change our hedonic or joy set point. Now those gremlins are camped out on the pain side of the balance. Now we need more of our drug in more potent forms, not to feel pleasure, but just to stop feeling pain. And when we're not using, we're walking around with a balance tilted to the side of pain, experiencing the universal symptoms of withdrawal from any addictive substance, which are anxiety, irritability, insomnia, depression, and craving. And this is why it is so difficult in a world of overwhelming overabundance to stop using these very appetitively reinforcing substances and behaviors, even when we want to. And this is why people with severe life-threatening addiction will relapse, even though they can see objectively their lives are better when they're not using. Their brains aren't necessarily better. Their brains have a change set point, which means that all of their energy and all of their creativity are consumed with trying to resist the urge to use again to get back to that homeostatic position.